Hi everyone, I hope you are all well. Thank you for joining me today. Today we are going to be talking about the three layers of the pelvis, the different joints within the pelvis, and how understanding these dynamics along with movement practices that correspond with these different dimensions can help to prepare your pelvis for labor, both in prenatal practices and then of course during childbirth itself. So to start, we're gonna talk about the joints within the pelvis. So first we have here the pubic symphysis joint. So the way that I'm holding the pelvis is, this is the front part, this here is the back part. So if you're sitting like this is how your pelvis is in your body right now. If you start at your belly button and you work your fingers down to feel the flat part, the flat bony part in front of your pelvis, there's actually a joint there, which is kind of surprising. I was surprised to learn this because this isn't a joint that we move on our own. But when you're pregnant and then during labor, your body is producing more and more of a hormone called relaxin, which is kind of a straightforward name. This hormone is surging through your body, through your muscles, through your tissues, your fascia, creating more space, more of an expansion, more flexibility throughout the entire body so that during labor, your pelvis can slowly start expanding outward, making more space. And that happens a little bit in pregnancy as well. Maybe I said pregnancy. It happens in pregnancy and labor. Of course, any kind of expansion is not going to be as exaggerated as this is here in this model that I'm holding, but it just gives you an idea that the pelvis is actually a moving set of bones. Two other major joints within the pelvis are here on the back, and these are the SI joints. So if you go ahead and reach around, feel for your vertebrae in your low back, feel for your spine. And as you continue to trace your fingers down, you'll start to feel this flat part of the pelvis, maybe some bony ridges there still. So that's the sacrum here. It's part of the vertebrae, but there's no discs in between. Everything is fused here. So it is a more stable, flat part. So that is the S part of the SI joints right here. And then here on the pelvis, we have the ilium, which is this big, thick, flat, bony part. The ridge here at the top is called the iliac crest. So again, if you come to feel your hips, you'll feel your hip point here in the front. You may have to press down a bit, and then you can follow that ridge all along the back line until you find the sacrum. So that's where the I comes from in our SI joints, sacroiliac joints. And then here at the very bottom, we have our coccyx, and that's the tailbone. And the tailbone is also connected at this really, really tiny little joint. There's really not a ton of movement there, but when your baby is ultimately leaving your body, when you're at the end of labor, the pushing stage, baby's exiting into the world, your sacrum is going to hinge open, right? So this is what it looks like normally. And then during that pushing stage, it's going to hinge open. Baby's head is pushing it through, maybe baby's bottom if you have a breech baby. And then this tailbone is also going to unhinge a little bit. So this is how those three joints are, or I guess I should say, this is how your pelvis becomes mobile and malleable, right? It's not just one hard block of bone. There is dynamic movement that becomes possible through these four joints. And so I always like to add here that if you have a provider that is telling you that your hips are too small or that your baby is too big to fit through your pelvis, I want you to know that that only happens in about 1% of births. And so with the 6 different plates that make up your baby's skull, that's what creates that coning, right? That cone head that can happen during birth. Because of their skull anatomy and because of your pelvic anatomy, your baby is designed to fit through your pelvis, and your body is designed to push a baby out. So I just want everyone to have that reassurance and that confidence that even if you have more narrow hips from here to here, that doesn't necessarily say anything about the diameter from at the inlet of the pelvis, which is here to here. And from that, we have a lovely segue into the layers of the pelvis. So at the top of the pelvis, this is called the inlet. It's where baby is entering into the pelvis. So that is this ridge right here at the top. The ilium start to drop off into the inside of the pelvis. And so this diameter around here can't necessarily be determined based off of how far apart your hip points are. So just remember that if anyone's telling you that you have too small of a frame to have a vaginal delivery. Okay, so the diameter here at the inlet of the pelvis is going to be lengthened, or I don't want to say optimized, but it's going to grow based on different movements that we create in the body. So that's going to come in a following video, but just for a brief example, if you're in something like a really deep squat, or you're bringing your knees really nice and wide and you're deepening into your pelvis, that's going to create more of this opening here at the top of the pelvis. And so you can see that when a movement like this happens, it's great for letting baby enter in, but what happens at the bottom of the pelvis? We start taking up more space. We start closing off the outlet. And so the movements that you would do at the start of labor are not necessarily something you would want to do at the end of labor. It isn't something that necessarily causes harm or creates any kind of emergency, but like we are seeing, it's taking up that space that we don't want to have taken up at the end of labor, right? So we think start of labor, open knees, open hips like that. As we continue to move down to the inside of the pelvis, we have these bones right here, which are the top of the ischium. The ischium here are our sits bones, which seems a little bit strange because when we're looking at this front of the pelvis and then we're feeling back to our sits bones, they're really in the back of the pelvis, right? So our pelvis is angled quite a bit like this. We're not actually looking at it head on like that in the body. So these are our sits bones here. And as we get up into the pelvis, again, we have this other flat bony part. So from side to side, this is going to be a completely different diameter than we have from the inlet of the pelvis, right? And so we wouldn't have that same opening like this because, again, we're taking up space in the mid-pelvis now. So what is going to create more space at the mid-pelvis? We're going to actually have asymmetrical movements. We're going to have some twisting movements, right? And so maybe you had one leg lunging forward, the other leg lunging back, or you could do things like side lunges. A side lying release is great. So that would be laying on the side of the bed or laying on the ground, crossing one leg over. Again, these are positions that are going to be reviewed in another video, so you have more concrete ideas and instructions of how to get in and out of certain postures. So when we think mid-pelvis, we think asymmetry, doing something different, changing up the shape or the direction of your legs. And then finally, like we already talked about, we have the outlet of the pelvis, right? So that is created by your sits bones and your tailbone here in the back of the sacrum. So how do we create this kind of opening and this kind of movement? What seems a little bit counterintuitive is actually closing the knees in together and then widening your ankles and your heels. That is the kind of movement that's going to create this kind of widening at the outlet. What's also really important to note is that, like I said before, your sacrum is going to be hinging back because of the pressure of your baby's head coming down. And so if we're lying flat on the back and putting pressure down on the sacrum, again, we're actually closing off that opening. We're taking up space that baby needs to get out. And so if you've heard the terms, or maybe in a previous birth, you've been told that there's been an arrest of labor or failure to descent, I really don't like these terms because it makes us think that our body has failed, or that there's been this malfunctioning, that, oh, birth just didn't work for you. And there's so much more to it than just like, yeah, I guess things just stopped. And that much more lives within this pelvic anatomy with movement. And so when you're looking for that motivation for staying active, staying moving, maybe you're trying to avoid an epidural, or maybe you're trying to push it off as long as you can, keep this in mind, that your body wants that dynamic movement, your baby wants that dynamic movement, and above all else, we want to be off of the sacrum, off of a lying flat position on the back and the spine. So I think that's everything. Please always let me know if you have any questions, if you want to discuss this further, maybe if you have a correction to offer me or something that you'd like to go deeper on. I'm always happy to have these open conversations, and stay tuned for that next video where we're going to be flowing through this a little bit more within a little yoga flow, so that you can have a practice at home that's going to specifically target these different layers through different movement. So thanks for joining me today, and I look forward to working with you more.